You wouldn't give someone treatment for 1 week and then after a week of normal blood pressure, you'll never have a stroke or heart attack. Like, it's a similar sort of thing here. Why bother to treat addiction? I believe that Dr. Christensen got this slide outside of his methadone clinic because of his very nice car. Actually, his car is not this nice, but someone had it. Just also to throw out, like, this is a disease that does not just affect the addict. So the theory of, those folks are bad, just let them get what they deserve, like, doesn't really hold up. Also, considering the number of families affected, I mean, something like 45% of adults are directly exposed to the pain of substance abuse via close relatives. 50 to 80% of all child abuse and neglect cases involve some degree of substance abuse by the child's parents. So the idea of sort of letting people flounder around and fail and get back up on their feet if they can, it sort of breaks down when you look at the fact that these are people embedded in a family structure, really affecting a lot of other, not that I think that that's right anyway, but even if it was, they're still affecting people who are innocent. Why treat addiction? In general, so there's a lot of talk in the medical profession about addicts maybe as not being the best use of your time and medical resources, because only about 40% of people will be abstinent at 1 year after treatment. However, this is a group of people with a lot of issues getting to aftercare, often due to insurance issues or homelessness. There's also some psychiatric comorbidities that either happen before or after the drinking or using, and a decaying of the social supports that really make it a challenge to treat any disease in this population. Relapse, it's however reinforced by the medical system, treating it as sort of inevitable and often hopeless. However, that's a really erroneous way to look at things. Like, for all chronic diseases, they require a continuous monitoring and treatment period. So there was a big study in 2000 showing the difference between recovery in terms of continuous abstinence for alcoholics and addicts versus the ability to perfectly control blood pressure or hypertension or asthma. And as you can see, that 40 to 60% of people with a diagnosis of drug dependence